Today's lecture is on patient education. The educated patient. What are benefits of patient education? Because it helps them to return to health and independence faster when they know what's going on and understand their part and role in recovery. They're less likely to call the office with questions. And again, they're more active in their own care. What is the medical assistant's role? Is to model good health behaviors and answer questions during routine visits. If you don't have the answer, find it for them. And give detailed instructions and printed materials. Sometimes this is given directly to the patient in the exam room, and other times it is given to the patient at the checkout area. Learning and teaching. We have three different domains of learning. We have cognitive learning or knowledge, we have affective or behavioral, and we have psychomotor or skills learning. Teaching technique. Factual teaching, cognitive domain. You will be in this cast for 6 weeks. It is waterproof. Just be careful how you use it. Sensory teaching or affective domain. Repeat back to me. Let me know if you understand it. And please, no jumping off, on trampolines while you're in your cast. Participatory teaching, modeling and return demonstration. All right. So if you're working with someone who has a partial splint cast, show me how you can take it off and put it back on each day. And verify your patient understanding through this participatory teaching and asking them to explain a procedure to you. Cultural and educational barriers may exist, and you'll have to work on those as they are presented. Patient education materials. Printed materials, brochures, booklets, fact sheets. If you've ever been to the ER, usually get a fact sheet on your way out. Educational newsletters can be sent out, and there's a community assistance directory that can be asked for and used. What about visual materials like DVDs? Seminars and classes, libraries, patient resource rooms, associations, and online health information. We all know about online health information, right? You've all looked something up online at one point or another. Promoting health and wellness through education. Healthy habits. This is consumer education. And this is a big role of the public health venue of healthcare, is that the public health venue, the public health providers look at different ways to educate the public on good eating habits, how to lower your cholesterol, that activity, regular physical activity is important, oral hygiene. So healthy habits and consumer education are a big part of the public health department. Protection from injury, that says it for itself. Preventive measures, again, promoting healthy behaviors. Screenings, go have those screenings. The mammogram screenings, the prostate screenings, all right? Pap smears are a screening. And rehabilitation, how can we help you get back to better health? The benefits of the information packet include the contents. So the patient information packet, maybe when you have gone to a brand new practitioner, they give you some package of information. So in this packet, in the contents of the packet, you may see an introduction to the office and the office philosophy. You may see who all the practitioners are, and you'll see all the different practitioners' qualifications and what type of practice it is. You'll be introduced to the office staff. The office hours will be there. Appointment scheduling information will be there. And these days, there will be a bit, maybe a small paragraph on using the patient portal. So the benefit for patient information packet is that a lot of questions are answered without taking up time and talking to someone. You'll see the telephone policy. If you call central scheduling, they'll schedule your appointment. Payment policies, and these you sign. You actually sign a form that says, if the insurance company doesn't pay, I will. All right, insurance policies. Now, just a short sidebar here. Your doctor's office doesn't know all the different insurance policies that are out there, because Blue Cross Blue Shield or United probably have 1,000 policies in each state that are different from each other. So we need to gently and carefully remind the patient that if they ask a question, do you know if this is covered, please contact your insurance to find out that answer. Patient confidentiality statements are signed. There's other information, and who distributes the information packet, usually the person at the front desk. Patient education prior to surgery. So providing patient education, if there's going to be a procedure or such as an operation or a day procedure, the practitioner performing the procedure will explain this to the patient. All right, preoperative education may come from you and it may come from the provider. In other words, 3 days before you come in for your surgery, don't eat any red meat. Don't eat any vegetables. The favorite one, after midnight, nothing to eat or drink in your mouth. Absolutely nothing. No Tic Tacs, no water, no nothing. All right, that's preoperative education. And we try to help relieve patient anxiety by giving them information so they'll understand what's going on. And that's it for today's lecture on patient education.